Hi, everyone. My name is Dr. Angela Pearce, and I'm completing the requirements for the first assignment for week one, the counseling disposition reflection assignment. The goal of this assignment was to address various key points or key elements associated with the American Counseling Association to determine or to establish our knowledge of what is to be done or what is to be said when it comes to the ethical codes, the personal identities, competencies, and other things. So to start, the first response where the first key element was to describe or read through the American Counseling Association and just like name the major sections for each code. Here we have listed the counseling relationships, which indicates that that developing relationships with developing trusting relationships with other counselors, professors, supervisors, or whatever have you, whoever has a stake in your success or whoever is involved in the success of you developing a professional identity. These are the persons that you need to establish a trusting relationship with. Also, mainly having a trusting relationship with yourself. Confidentiality and privacy, meaning that it is imperative to like make sure that the clients trust you, meaning that you don't share their information, share their personal information. And this is particularly the case to where using technology is a key factor where you want to make sure that the client is protected at all costs, meaning that you don't want to breach any kind of fiduciary duties that you have to this clients, and you also want to maintain and uphold certain boundaries. Professional responsibilities, it is of essential, regardless if you're in the counseling profession or any other profession. You have a personal responsibility to maintain honesty and openness and integrity. You should be non-discriminatory in your actions. You should set professional boundaries and remain competent, regardless of any profession that you are in. And this is particularly the case for a clinical professional, because these clients, they in the public, they highly rely on you for your knowledge, skills, and abilities. Relationship with other counselors, again, goes back to the counseling relationships. Of course, you're going to start developing relationships with other counseling professionals. So we need to make sure that we maintain boundaries and set certain precedences when it comes to dealing with these with other professionals. This is particularly the case when it comes to like sharing knowledge, skills, and abilities, and also leading on to one another for social support, mental support, and to like help you maintain your emotional well-being. The evaluation, assessment, and interpretation of, sorry, my computer has a mind of its own. The evaluation, assessment, and interpretation, meaning that you want to make sure that you remain astute when it comes to like doing evaluation, assessing, and interpreting individuals or clients' behaviors, their actions, and things like that, whatever, to determine their overall well-being, to see how there's various elements or even environmental factors or cultural factors that is impacting them psychologically or even like even in their career there can be like some triggers or some things that they have to face. So you have to make sure that you're able to, or you have accumulated a certain level of knowledge to where you're able to efficiently and effectively assess these individuals. When it comes to research and publications, whatever, we want to make sure that we remain astute when it comes to like the publications, meaning stay abreast in reference to like the various releases of new documentation. Therefore, because that'll give you the ability to continue to personally and professionally develop your skills. It gives you opportunity to work with others. It'll give you even the opportunity to contribute to existing bodies of literature, and also help remind you of the ethical standards and the boundaries that you have to set in the counseling profession. When it comes to distance counseling, technology and social media, I think I touched on this a little bit before, or wherever, because when you use technology, a lot of times there can be some ethical considerations to look at or to pay attention to. The ethical concerns is making sure that the counselor is able to effectively and efficiently use technology. And even when they're not, they also have to make sure that they put in the time needed to be able to use these technologies effectively and efficiently, meaning that it's essential for them to be able to pay attention to the client, read their body language, make sure that they have eye contact, make sure that they're able to assess their clients, make sure that they're able to provide accurate treatment and provide them with accurate feedback in reference to like the things that they're dealing with. Resolving ethical issues, the ACA is essential when it comes to like having to deal with ethical issues or concerns, also behaving ethically, and also them being a supporting factor when you have to face ethical dilemmas, meaning that they're going to have your back, whatever, they're going to help you, they're going to help you through the process as far as like how to deal with things, whatever, to make sure that you're not violating any laws or any kind of governmental authorities, and making sure that you're being compliant when it comes to your profession. Next, we have to address, we have to discuss personal beliefs regarding the ACA Code of Ethics and how they're significant in the counseling profession. The ethical beliefs that's listed in ACA is as follows: enhancing personal development throughout the lifespan, honoring diversity, culture, prolonging social justice, protecting the clients, protecting the public, protecting society, safeguarding with integrity, and building professional client counselor relationships, as well as counselor relationships, as well as any other profession, because again, you have to maintain a professional identity to make sure that the public, as well as your client, as well as your clients, know that you have developed a certain mindset, you have emotional intelligence, and you're able to deal with and cope with various situations, regardless of any kind of uncertainty, and making sure that you remain competent and ethical in all of your practices, whether they're professional or personal. Next, we have to consider three dispositions and what are their strengths. I did a little research on this, whatever, and I have like empirical evidence to support my decisions. First, I chose being ethical and abiding by all laws, whether they're ethical codes of conduct implemented by or demonstrated by the ACA, laws, whether they're state laws or federal laws, and any governmental entities where there's going to be a plethora of them depending on the state that you live in. The other one, this is a strength because it sets the foundation as far as like how you can remain ethically erect and to protect your professional identity as well as your personal identity, and to also ensure that you protect your clients. You want to remain competent in everything that you do, and you want to make sure that you look at if you're being ethically sound before you take on any client or before you take on any kind of disposition when you are practicing in the counseling field or any medical field. And you're going to have to engage in continued education to make sure that you continue to be reminded of what these ethical codes are. The other one is interpersonal wellness. I've read various literatures to suggest that being mindful of your personal well-being is essential because your personal well-being can affect how you treat patients, the kind of treatment, how you assess patients. It can also cause you not to pay attention or pay that close attention to your client's needs or wants, and also assessing them in regardless of whatever psychological issue or life issue that they're going through. You're not taking care of yourself, meaning that you're only adding additional stress to your clients. They're already vulnerable. So you need to pay attention to yourself and make sure that you're healthy, whatever, so you can provide healthy results for your clients. Setting professional boundaries, whatever. A lot of times people fail to set professional boundaries, or a lot of times they allow their boundaries to be crossed. I understand this as far as like being a professional myself, whatever. There are times where people will try you, I would say. They would try to do what's necessary, whatever, that benefits them, whatever, and not necessarily taking your feelings and your time into consideration. So it is essential that we set boundaries. A boundary can be time limits, time restraints, how much time you spend with the clients, meaning that you can't, a boundary is not calling me after a certain time. So these are boundaries that you can set, professional boundaries or even other boundaries with other counselors, meaning that not developing a romantic relationship with these individuals. So these are boundaries that you need to set in this profession. Identities of growth, I chose professional competency and professional identity. These two actually go hand in hand because in order to remain competent, it's a key portion of you developing a personal identity. I say this because in order to develop a personal identity in the counseling field or the mental health counseling industry, you have to be professionally competent, meaning that you have to hone very certain knowledge, skills, and abilities to make sure that you're able to communicate effectively with your clients, to make sure that you're able to assess them properly, make sure that everything that you do is empirically backed, and to make sure that also you set boundaries. Again, I just talked about that. This will also be part of your growth will with you demonstrating this, it'll also part of your growth would be you forming new connections and social networks with other counselors as well, whatever. Therefore, they can contribute to your growth and your development in the professional field. Describe how you plan to develop a professional identity. Ways to develop a professional identity. I think I just talked about this is more so of continued education per se. And then also professional workplace experience, meaning that you have to be out in the field, whatever, in order to develop a professional identity, whatever. You can have all the academic knowledge and experience that you want, whatever, but until you get out in the field, you have to be able to demonstrate your professional identity. It's not necessarily about you saying that you have a master's degree as a psychologist or you are a licensed psychology. Professional identity means that you have encompassed any and everything that you need to accomplish to maintain or to establish that professional identity, but abiding by the ethical codes, knowing what they are, knowing how to work and deal with clients, knowing how to associate yourself in public settings, knowing how to associate yourself when it comes to like going outside of the realm of your profession, meaning that your professional identity is going to intertwine with your personal identity, meaning that regardless of where you are, what you do, whether you're in a professional setting or a personal setting, somebody's always watching, meaning that we want to maintain a professional and personal identity, whatever that is, positive, and we demonstrate positive behaviors, and it allows us to remain self-aware and also to constantly self-reflect, whatever, because we getting into the counseling field is essentially it's a clinical profession, but it's more so of like in the same realms of being a nurse, a doctor, meaning that regardless of whatever situation that you find yourself in, you have to have that professional identity and you have to respond accordingly. For the ACA in your state, for the ACA, whatever, I didn't choose my state, but I chose the ACA as far as like the benefits, activities that is offered to its members. Listed are some of those benefits. The ACA allows professional counselors or even counselors in training to establish professional credibility, whatever this can be through continued education. This can be a result of abilities to publish in various journal articles or social networking or whatever have you. Practice and support, meaning that counselors helping counselors or having that support system that can help you to be successful in your practice. Advocating for the counselors to make sure that their voices are being heard and to make sure that they are getting the attention that they need when it comes to supporting their profession and make sure that they're being recognized. Community connections is more so about, again, the social networking, being able to go to like various conferences, being able to write publications, being able to collaborate or cooperate with others in the profession or in the counseling profession. Listed are also additional benefits that is associated with the membership of the ACA. Again, it gives you the opportunity to develop a professional relationship, meaning that it gives you like the continued education options, options to receive magazines, book publications, whatever that can help you stay abreast in your profession. The last key element that we had to address was the implications regarding the ethical uses or using technology for psychotherapy. Some of the key issues that the ACA has demonstrated is that when you use technology for your therapeutic practices, a lot of times there is a concern about privacy, confidentiality, and security breaches. A lot of people suggest that counselors may not have the necessary competency to use technology effectively and efficiently, whatever, meaning that any kind of communication-based technology, whatever, there's question about how effective or efficient it is. And when using it, are you able to like actually treat the patient or like to like evaluate the patient efficiently or efficaciously? I mean, because there's like an absence of verbal cues, meaning that you can't necessarily see how the person is moving. You can't understand the body language or things like that, whatever. So they're able to, so this online communications may lead to a bit of misunderstanding and misinterpretation on the counselor side, as well as the client side. A lot of times there are emergency issues where where the patient needs to have their issues addressed immediately. However, when doing this, whatever, when using technology, you're unable to verify certain elements of the counselor, meaning that a lot of times you find that people don't want to use their videos. So you can't necessarily verify the patient's identity. You can't verify the locations. You can't verify the address as to where they're having where they're having their sessions at. Again, another concern is informed consent. You can, when you sign the informed consent or assent online, you cannot necessarily determine if it is the actual client who is signing this document. So these are some things that we have to be careful of. So again, I thank you guys for allowing me to present and share this video with you guys. I look forward to any kind of questions or concerns that you have. Again, I'll see you in class.